the show, everyone. I am so excited about working with everyone right now and networking with you all. We are live on Facebook, so I do want to say hi to everybody out there. Like us and follow us. We're going to share the show later on. I talk about everybody else on this show, and I love my show because of all the information that people get here. My first guest has been on with me several times. I have with me Dr. Mikkel Jarman, and he is the owner of Pediatric Foot and Ankle. Tell everybody a little bit about yourself. We obviously know a little bit about what you do, but you specialize in children.
Oh, you got it. Yeah, kids all day long.
All day long.
Yeah.
So tell us a little bit about that and bring that mic right up to you real close so
bet.
we can hear you. So tell everybody about why you specialize in children and what's the difference, this is important, of what the difference is of working with children's feet and adults' feet.
Yeah, they're very different. Kids and adults' feet are not the same. They're not treated the same. And there's different protocols that we follow when we're trying to, fix these problems. I do want to answer something, Carol, because you were asking me earlier, what type of truck or vehicle do I drive? I get asked that all the time. What type of vehicle does the podiatrist drive?
I do want to know that.
Yeah.
I've been wanting to know that ever since I met you.
It's the tow truck, of course.
Oh, how cute. I love that. Oh, how cute. Oh, my God, I have to write that down. I wish you were coming back. That is hysterical.
No,
the tow truck.
The tow truck. No, but...
no wonder the kids love you so much.
Kids and fractures. That's something that's a hot topic. I'd really like to, answer questions and help people out there that are watching understand the differences, like why we treat kids so differently. When we take our kids to see, or to an urgent care or to a practitioner, you'll find that there's discrepancy sometimes on how docs treat fractures or treat kids and their fractures.
You said that you wanted to kind of focus on fractures today. And I want to also get it clear because one time you were on and we were talking a little bit about urgent care.
Yeah.
And a lot of people right away, they take them to the urgent care. And you ought to see them because I think you said how they don't really know how to really treat them the way you do. So yeah, you might take them there, but then you need to make sure you follow up with someone like you. Is that correct?
Yeah, because what you'll find is the urgent care is not wanting them to follow up with them. So typically the urgent care is referring them out to see the specialist. Us being the specialist in foot and ankle for kids, right? A lot of them are just showing up right in our office after they've been to the urgent care. But what happens when you go to the urgent care is typically the physician there is wanting to take an x-ray. And they're wanting to look at the foot and make sure nothing's broken. And that's great. The difference is, though, is that when a child goes in and gets an x-ray, you have the physician that says, yep, let's take the x-ray. You have the tech who takes the x-ray, and then you have the radiologist who reads the x-ray. And sometimes those people don't really talk very well. And so when you have the radiologist looking at the x-ray and reading it, he actually really isn't the one who's seen the patient, looked at the patient, or knows where it hurts on the child's foot. When you're seeing the specialist, like myself, right, when we come in, I'm wanting to see the child. I want to know where it hurts, and then we're taking those digital x-rays in the office, and we can compare the two. And that's beautiful because in the treatment room I have a laptop and their digital x-rays, and I can pull them up, and we can sit there and poke and prod on these little kids and like, where does it hurt? It hurts right here. And then we can go and look at the x-ray and say, this is the area that we're concerned about. This is the area we're focused in. Another very interesting thing that happens is in the urgent cares is that when x-rays are taken, they only take x-rays of the actual foot that's injured. And you would think that totally makes sense. But we don't know what we're comparing it to.
Makes sense what you just said.
So you want to look at the left and the right foot to look at symmetry. I had a child in my office Friday and seen at the urgent care, and there was a debate of whether or not, well, I won't say debate, but he wasn't sure if it was fractured. And one of the things we'll talk about today too is growth plates. And you look at the x-ray and like, I see a line, it looks like that there's something broken on it. And they weren't sure, so they were following up, with the specialist because that's what they were told. And we take an x-ray of the other foot and you compare the two, and it is crazy obvious that one is broken and the other one is not. So
well, it's also important for you to go to a specialist too afterwards because they don't have all of the up to the kind of I don't want to say equipment, but you know, you have everything, and there you get so excited about when you talk about some of the things that you have, because you can fix things that people maybe think that you can't. You also have to understand that these are children's feet we're talking about here. Now, you're located in Chandler. You do free consultations. You do same-day appointments. That's another thing that you do. And right now we have a lot of kids running around and probably getting a fractured foot or toe or whatever. It's going to happen. We know it. So their phone number is 480-534-7220. The website is pediatricfootankle.com. Now, I want to go into these fractures, okay? The difference between some of the different kinds, right? Because not everything, a fracture can be really bad or just a little bit, right?
Yeah. So when we think of fractures, we think, okay, bones are broken. And you would think, oh, I can just look at an x-ray and, we can see a broken bone. And unfortunately, it's not like that. Think of if you had a sheet of metal. And if you took a piece of metal and you bent it 1, 2, 3, 4 times, and then when you get to like the 10th time of bending it, it cracks. Now, the sheet of metal may not have separated, but bones are much like that. So bones can stress, and that stress will crack the bone, but may not have separated. Now, if there's a lot of force, the bones will break and separate, and we can definitely see that. But whether the bone is cracked or separated, it's still fractured. And then, depending upon how bad the fracture is, determines, does it need surgery, or does it just need a cast immobilization? And so, there's lots of variations that exist in that, and that's why a good workup from a specialist is really, really important.
Also, I think that there's a lot of myths about fractures, because I think I once said when we were on before, like when I was a kid, oh, that's a fracture, you can't do anything about that, right? Or don't go to the doctor because they'll just tape it anyway. Those are the things we heard. And the other question that I have in my mind to ask you, a break, you could think, oh my God, you broke it, that must really hurt. But does a fracture hurt just as much? Is it just as bad as a break?
Yeah. Well, you may be referring to toe fractures as far as like, oh, we broke a toe and tape it, wash it.
Tape that. But if you fracture your foot, it's different.
Your foot or your ankle or your tib fib in your leg, those are very, very different. Those are unstable. They hurt really, really bad. So if I was saying, if you had a broken toe and the toe was straight, we just say buddy tape it, give it a couple weeks of being careful, all should be fine. But if you break a toe and the toe is like crooked to the side, well, you need to see the doc, because someone needs to numb that toe up and straighten it out. If you have like a lot of swelling, this is very common. Kids are invincible. So kids will break bones in the midfoot, they'll break them in the ankle, and the day that it's done, they're hopping around, but the next day they're like, oh, they're a little bit better. And as a parent, you're kind of like, well, I don't want to take my kid, to urgent care. Maybe they're all better. Maybe they'll get better. And they seem like they do. But those kids that are not immediately getting better the next day or two really, really do need to be worked up for fractures or ligament injuries or tendon injuries.
And kids don't tend to talk about their pain like adults do, and that's something that you've talked about as well. Most commonly fractured child in a child is what?
Well, other than the toes, we'll miss the toes. We're going to say in the midfoot. We'll see a lot of broken bones that happen in the midfoot, and these are usually from kids falling. So it's very common. We'll see across the midfoot, the toes will actually just snap and break. Skateboarding accidents, it happens all the time. Kids are doing this intense parkour activities now, or these trampoline parks. They're great. They keep,
you love them.
They keep us medical professionals in business, but
we're gonna
they're hard on little kids.
We're going to go to a break. When we come back, we're going to talk further. Let me tell you, first of all, our kids want to have a good time, and they do. And today they are doing tricks, and they're doing all sorts of things. And when they get hurt, you want to make sure that you do go to a professional. And he specializes in children. The number again, it's 480-534-7220. Hang tight. We're going to be back in just a minute. So we're still live here, so we're going to keep on talking. So for you, when you say children fall, go ahead. When they fall, then the children are falling. Again, sports, right? They're going to twist. Can they fracture? And let's say when they're playing, let's say baseball, they're running. Can that happen as well?
Yeah.
Anytime they can fall.
Yeah.
Right.
I mean, we'll see kids. You can have just it's not necessarily always has to be trauma that introduces a fracture. It could be they just rolled their ankle, they stepped wrong off of a curb, they came down funny on the leg, and you can break a bone, or you can stress a growth plate.
We're going to talk about growth plates when we get back. And the other thing that I wanted to say too is shoes, right? Now, I know that when I was a kid, the platform's really big, right? So all the pediatricians, I want to say podiatrists, they love those shoes. But today, you don't have to be wearing platforms to fall. I mean, flip-flops are probably the worst thing that people are
you'll
wearing.
Slide out of them. Yeah.
Right, and that's all they wear, and especially right now in the summer.
Yeah. We like stability shoes. We like closed-toe shoes. We like shoes that have laces. We like shoes that have stability, like our Vans and our Converse. We're not too crazy about,
but everyone wears.
But to be fair,
here.
if you don't have foot problems, it doesn't really matter what you wear. To be fair.
But honestly, they cause problems.
They do cause problems.
I mean, I have my stepdaughter was wearing, little flip-flops, went flying, and of course went right on her face, and Anna fell, and she did hurt her foot. She, when you fall, if you are unstable, it's how you land, right? Yeah. And that's when it happens.
Yeah.
So growth plates, we're going to talk about that when we come back here, and for why is it so important to talk about them?
Well, a growth plate, because it's the variation. It's what differentiates adult maturity from pediatric maturity. Yeah. So growth plates are a big deal. When we're looking at growing kids, all kids have growth plates. It's where our bones are maturing, developing, enlarging. It plays a big part when we're looking at how they're going to heal. It's a big part about how we do surgical intervention. And it stages things for them as they grow up, depending on where the growth plate is in development.
It could affect them through their adulthood?
Absolutely. So a child who injures a growth plate, it may stall the growth of that bone, and the other bones will continue to develop, but that bone won't grow anymore.
Well, we're going to talk about that now. So welcome back. You said that you wanted to talk about growth plates, and let's go into them deep now.
Yeah. So growth plates are pretty fascinating things. Kids have growth plates, adults do not. This is a huge differentiation between how you treat adults and children, because if an adult breaks their ankle, right, you have surgery. You always have surgery. You put plates and screws in. If a child breaks their ankle, you may not have surgery. We may try to just realign it and cast it, but if there's displacement, we'll do surgery. But because there's open growth plates, the surgical technique and how you fix these bones is completely different in kids and adults. And there's often staged intervention after a child has to have surgery with fixation, which is screws or plates that are placed in their bones. We actually have to remove them, because if you don't remove them, the growth plates, as they're trying to grow, will fight against this hardware, and it will deform the bones. So it's not uncommon a child who breaks their ankle or breaks their foot and has to have surgery where we're putting in plates and screws, that several months later we're actually having to take them back to remove it so that their foot will want to continue to grow normal.
Well, I want to say this too, and I say this periodically. I think you should put this number in your phone, because something like this isn't, maybe your kid right now, this second, has fallen and has a fracture. We don't know that, right? But put the number in your phone, and you have a reputable, somebody who specializes in children. The phone number to call is area code 480-534-7220. The website is Pediatric Foot Ankle.com. They are located in Chandler. He does free consultations, and what he does is he does same-day appointments, and you do that on purpose. I remember you had spoken about that.
Yeah, we have trauma that comes in. It's not, it's every day. We have someone coming in with some form of trauma or an active infection, and those are priorities, so we want to get them in, so we leave, availability on the schedule.
Absolutely, but it's nice that you do that. Not everybody does, right?
No. I'll tell you what's really interesting, though, or another interesting fact about, we'll talk about like podiatry, foot and ankle. From a surgical standpoint, I do surgery every Wednesday. I do a lot of surgeries on kids because that's obviously what I see. But because of that, we get really good at what we do. There are other doctors, that do surgery on kids. But if you were to go to your orthopedic that only specializes in hands, right, they're not going to do your hip. They're not going to do your knee. They're going to send you to that specialist. And so that's how we operate, is that I only see kids, I only do foot and ankle, and it makes us really good because the surgical procedures we're doing are repetitive, they're reproducible, and it gives us reproducible outcomes at the end of the day.
I think that's important for people to understand that, okay? The other thing that I wanted to ask you is when we talk about strains, right? What's the difference? Because, obviously someone's going to get a broken, we know the difference between that, we know what a fracture is, but when somebody strains their ankle, it can hurt just as bad.
Strains and sprains. So strains, sprains, fractures, it's just kind of a degree of how we roll our ankle. And so you might see what we call ecchymosis. That's where the black and blue formation starts. It's bleeding under the skin. When you see bleeding under the skin, these are the things we start to think of in my world is, one, did we break a bone? If we didn't break a bone, then we probably ruptured some soft tissue ligaments in the ankle. And we want to make sure that we immobilize. And that's something that I'd love to talk about too, is the level of mobilization. But what we find is that kids who don't get mobilized, let's say we roll our ankle, let's say it's not broken, we just rupture some ligaments. Those kids eventually turn into the adults that say, my ankle always rolls. It always feels unstable. Oh, I could be walking and I'll roll it again. So somewhere along the line, there was that initial injury, and it usually happens in our childhood, and then there's this kind of a failure, unfortunately, to take it serious and immobilize the children, or immobilize the child either in a cast or brace, a boot, something. And then it just doesn't heal upright. Another thing we'll see is that a child will come in that has a history of ankle injuries, but it's not that it hurts on the outside, it hurts in the ankle. It's because sometimes the cartilage gets injured in the ankle joint when they roll it, or even in a fracture. And then these lead to chronic issues. So it all stems from the beginning. If you treat it right from the beginning, it all wants to heal up.
Well, the first thing I want to say is parents need to take it seriously.
Yeah.
Right? Because especially with our kids. Oh, it's okay. You can, right?
Yeah, I'm not a doomsday guy, and I have kids. I got 5 kids of my own, and I understand that because, kids are invincible, and you want to just see, are they going to get better, or are they not? But, if your child is just still limping after a week of an injury, you should take it seriously.
Absolutely. A week is a long time. I would say sooner than that.
Well, it's serious.
The only time they feel so bad when it happens, I'm sure, the next morning it's like blown up, right? And
I'll have parents almost sometimes in tears. You show them the X-ray, and they're like, "Oh my gosh, I can't believe I feel so bad."
Right.
It's okay.
Right. But the first thing that someone should do, obviously, elevate it.
Yeah.
Would you say, and put ice, or what would you say?
Yeah, we say elevate it, ice it, NSAIDs, compression, NSAIDs or ibuprofen or some sort of anti-inflammatory initially, and that's kind of in this watch and wait. Obviously, if there's immense swelling or you see discoloration, that prompts some urgency to get some imaging.
Big time. Yeah. Imaging. I was just looking at this, that sometimes that you do MRIs and even CTs. And that seems like, wow, doc.
Overkill, right?
Yeah.
Here's what's interesting is that, when we see a child, there's this term of this growth plate, and we call it apophysitis, and then there's fractures. They're very difficult to differentiate a stress fracture from an apophysitis. So when I see a child initially, we don't say you have a fracture. If I don't see a fracture, it's not a fracture, but I immobilize them. I typically put them in a boot or walking boot or a splint or a cast, or somehow we want to cripple them down. We have them follow up, and that's the key moment. That's the pivoting moment. When a child that's been immobilized for 2 weeks, if it's a growth plate injury, at that time, they're doing phenomenally well. The child that shows up at 2 weeks, and you touch that area of where it was injured, and it's still sensitive, like really sensitive, it's broken. Now, the issue, when I'm sending a child out for a CT or for an MRI, is because the concern I have is, has it really healed? Or when we're searching for fractures sometimes, and these kids have chronic pain of stress fractures, sometimes we can't tell where they are, and so that's what we're looking for on an MRI, or we're looking for other pathologies such as like coalitions or malformations within the structures of the foot. So imaging is a wonderful way. No one goes straight to imaging to say, oh, let's just get an MRI or get a CT and let's see what's wrong. That's not good. That's not good medicine. But in someone who's being treated and you have a child and you've immobilized them and they're not responding, you need imaging.
Well, I still think this is what you've been saying all along. Your children's feet are different than adults' feet, and if you don't make sure that you are taking care of it, then as they grow older, there's just problems all along. You said already that said, oh, my feet they're always turning in, my ankles are always turning in. It's probably about something that happened when they were younger.
Yeah, possibly.
And if they were not treated correctly, that's the whole thing. That's what you're talking about, and you want to go to a specialist who just works on children. That's what you really want, and that's what you do. Again, that website is Pediatric Foot Ankle.com, and their phone number is 480-534-7220. It is the summer. The kids are out there having a great time, and they should, but they're going to have accidents, and if they fall and they hurt themselves, call them. They're the people to call. I want to go back into here while we talk about long-term damage.
Yeah.
Let's talk about that.
Yeah, well, the level of immobilization can determine how fast things want to heal up, and that determines, if something heals up quick, right, we're good. If it heals up slow or doesn't heal up, we have troubles later on down the road. I find a lot of kids that are coming in, and I don't want to say urgent cares. There are lots of really good urgent cares. There's lots of great doctor offices. So I do not want to make a statement to say that they're not. But unfortunately, I get to see everything under the sun, and the level of immobilization is just insufficient with a lot of other doctor offices. And when I say that, we think of what's a gold standard to immobilize. If I asked you, you broke your arm, how would you fix it?
If I broke it, I would go to the doctor.
Well, what would they do?
Cast.
They put a cast on,
on.
right. And so why wouldn't they put a cast on someone who has a broken foot? It blows my mind that there's doctors that don't do that. And so that's the gold standard. You have a fracture, you need to be in a boot, or in a cast. You need to be cast for 4 weeks. Then you transition in a boot. And there's lots of doctors, unfortunately, that'll put kids into boots with fractures. And they just don't want to heal up. Kids are invincible. They want to run, they want to play, and
right.
you just can't slow them down. But you put a cast on them, you can slow them down.
Right, and then the parents are upset.
Yeah, because they got their kids in these after hour or after school activities, or they're in these leagues and organized sports, and they don't want to take them out.
But you know what? Also, kids they kind of adapt. They do adapt.
They adapt very well to casts. We give them a knee scooter, and they're like racing around on these scooters. They do fine.
What are your final words for today for everybody? What would you say to them?
Oh, I think you should listen to what your child is really saying at times. We tend to be in this world where there's so much noise going on. We hear our kids complaining. But when a child is actually saying, Mom, I think something's wrong, listen to them. I had a child last week that had glass in their foot, 2 years, until a parent finally listened to them, and we got that glass out.
Oh my God, that must have been terrible.
Listen to your kids.
Listen to your kids, and write this number down. The phone number is 480-534-7220. It's pediatricfootankle.com.